Hi, I'm Janet. Welcome to JanetsHUB, celebrating you every version. Today we're at the Institute of Aesthetic Surgery in Altamont Springs, Florida with Dr. Richard Gregory, also known as Dr. G. He specializes in plastic surgery and facial procedures. He is board certified. We're excited to be here with him today. We're going to be talking about the fine art of Botox. So Deidre, my dear friend Deidre,
hi.
I know you started Botox because you were having headaches.
I had actually been to a neurologist several times and started having really bad cluster headaches where stress-induced, of course, being a single mother and running around like a crazy person, I would get headaches really bad that would put me down for about 3 days. I would literally lose my vision.
Wow. And so it helped you?
Yes, it helps me tremendously. It helps relieve the pressure. I very rarely get headaches now, actually.
So Dr. G, do you get a lot of patients that have headaches?
I do, actually. It's interesting that I have a lot of patients come in for cosmetic Botox for wrinkles and so forth, and yet they get relief from their headaches. I've had patients tell me, in fact, that it's much more cost effective for them to get their Botox for their wrinkles and relieve the headaches because they don't have to pay for the Imitrex or whatever they're taking for the headaches.
Nice.
So we get the benefit of
sure.
release of headaches, but also no more wrinkle puppy, which is coming soon.
Now, I think you said you're asymmetrical, as I am.
Yes.
I have one eyebrow that's higher than the other. So if I wanted to lift an eyebrow, can it lift?
We have muscles which raise the eyebrow. We have muscles which pull down the eyebrow. When we're raising the eyebrow, the muscle pulling down the eyebrow relaxes, and vice versa. So the fact is, if we want to raise the eyebrow, we keep the muscle which raises the eyebrow, and we relax the muscle with Botox that depresses the eyebrow. I like this facial diagram, particularly for the education of the patient. It shows many of the facial muscles. These are the things that cause the lines and the expression in the face. I don't like to totally take away the muscle movements. I think people need to have a natural expression. That's how we know whether they're happy or sad. And so many patients come in and say, I don't want to look angry, I don't want to look sad and so forth. That's sort of motivation. The fact is that you do need some facial expression. The muscles actually show the balance of them, for instance, and I'll show you the approved muscles are actually the frontalis muscle is not approved, but the glabellar muscle, what we call the corrugator muscle that causes the 11s or the 111s down here, the vertical lines, that is approved by the FDA in 2002. The crow's feet muscle is a muscle that goes around the eye, and it's probably 1,000 muscles. We're just treating the corner of the eye over here. If you were to treat the whole thing, you would lose some function of the eyelid, and we don't want to do that. So we actually confine our treatment to the edge of the eye over here. But it's interesting is that the creases actually are not only a product of muscle action, but they're also a product of aging of the skin. Because the skin thins out, it loses elasticity. So when you're young, you smile, your crow's feet show up, and they go away immediately when you stop smiling. As we get older, those stay there. In fact, sometimes they're embedded, they're etched into the skin. And those are the patients that we may want to do laser or fillers too. But certainly the Botox will relax the muscle and take those away.
So Deidre, you said you get the headaches and you want relief on your headaches. So how does that work? Who can have it?
Well, it's very interesting. Deidre was saying that she has cluster headaches, and there are several different categories of headaches. The one approved for treatment by the FDA and sometimes covered by insurance are migraine headaches. But the requirements for getting that treatment by the insurance company and Medicare and so forth are fairly stringent. For instance, they require 15 disabling headaches a month. And these are the people that get the eye symptoms, the blindness or the flashing or whatever else. It's really a disabling disorder. And certainly Botox, if it treats it, that's great, and it does. So I think that that's been a big relief, but people shouldn't expect to have their Botox paid for migraines if they just occasionally get a migraine.
Right. What muscles are involved when we, if our lips are drooping? And then what muscles are involved if we have the bunny nose thing when we smile?
Excellent question. In fact, I'm going to show you my diagram here again because there are lots of facial muscles. In fact, there are 8 facial muscles, for instance, which raise the corner of the mouth. There's a muscle down here that pulls the corner of the mouth down. And when people complain about the droopy corner of the mouth, when they begin to get drooling, for instance, and so forth, they have a problem with the marionette line down here. Sometimes you can treat this muscle down here, which lets the corner of the mouth come up.
So I've heard of Botox parties. What are your thoughts on Botox parties?
Well, I want to emphasize first that this is a medical procedure. In fact, the FDA has it regulated to the point that it has to be done by or under the supervision of a physician. It does carry with it some minor risks as far as that goes. In fact, I had a patient send me the other day a whole sheet of papers of potential risks from Botox. And you know, you can always find the symptom. Well, I've got dry eye. Is it due to the Botox? Well, you can always find that. In fact, it's interesting that the FDA requires the manufacturers to report any kind of an incident that might possibly be related. And so they accumulate all this data on the most unlikely things of all happening. For instance, take dry eye. Dry eye happens so commonly in people. How do you know it was the Botox? How do you know it wasn't something else?
Take your contacts out.
Exactly. So anyway, the bottom line is that you can always find something to correspond to the symptoms you have. And if you want to blame that, that's fine. But the fact is, the study that they did when they first approved Botox for the glabellar frown lines in 2002, there was a 3% incidence of a droopy eyelid on one side compared to placebo, which was saline on the other side, okay? So they knew that it does happen, and it's primarily related to the depth and the site of the injection, and you can prevent it. So subsequent studies, for instance, showed it wasn't a 3% incidence. In fact, in our practice, we rarely see anything like that.
If you know what you're doing.
Exactly. It is a medical procedure, and therefore it should be done by someone knowledgeable about the procedure, and like I said, it has to be done under the supervision of a physician. But let's just talk briefly about the aging face and what we see. First, most evident, obviously, is the skin. As we know, the skin will thin out. You lose collagen in the skin, you lose elastic fibers, you lose actually some pigmentation, even though we get spots on the face which are irregular pigmentation. We call them lentigos.
Yeah, I've been noticing.
But the fact is that we get all these things, and that's the process of the aging face. They say that 80% of the aging face is achieved before age 18, meaning the sun exposure we get as kids basically counts a lot towards our later aging. The second thing is we lose volume in the face. The face actually, as shown on this diagram, changes a lot. From a young person to an older person, you can see the difference in the nasolabial creases, the sagging, the jowls, the lowering of the eyebrow here. Those are all things that we look for in the aging face. Our face actually has a number of fat pockets in it, and these fat pockets basically what cause our chubby face as a youth, but our gaunt face as an older person. So that's when we start talking about filler material, and there are lots of things we can cover there. So let's not go into any details now except to say that filler material will help these areas where Botox sort of runs short. It will not do a volume replacement, for instance. Okay, I'm going to start with cleansing the skin first. We all have bacteria on our skin, of course, and we want to make it as clean as possible. By the way, you shouldn't do this if you have active acne around. That's an infection, and you don't want to spread the infection. So it's a good idea to stay away from that, okay? But other than that, what we do is cleanse with some alcohol across here in the area we're going to be treating. Now we're going to start with the glabellar frown lines, the 11s or the 111s. Hers are probably still at the 11th stage. You see that? So I'm going to put some spots on there where I want to do the injection. Typically, you use about 20 units for this. That's what the FDA specified in their study, so that's what we'll do. So I'm actually going to put some marks on her here. I'd like to have the patient activate, so squeeze that together. You see the muscle actually comes all the way around here, like this, okay, like that. And the other muscle is over here like this. It almost looks like an arrowhead. So the first part of it we're going to put right in here, okay, that'd be the first place. Gravity will tend to pull this down a bit, by the way, so we always go a little bit higher than what we think we need it. So there's one place, here will be the second place, and the corresponding on the other side would be about here, actually, and about here. So those are the areas where I'm going to do it, but like I said, I want to put a little bit down in here too, and here. Now, one other thing I want to point out too, can you wrinkle up for me? See this line right across here? That's a different muscle. That's the procerus muscle, but many times we'll put a little bit of Botox right in there in order to reduce these transverse muscles. When it comes, actually, it comes in what appears to be an empty bottle, but it's lyophilized or freeze-dried. So the toxin actually looks like an empty bottle, and we dilute it with either normal saline or with bacteriostatic water. We prefer the bacteriostatic water. You can also dilute it in different concentrations. Occasionally, if we want to try to confine the effect of the Botox to a very small area, and we don't want it to sort of wander, if you will, we'll use a very, very small amount of fluid, but it'd be highly concentrated, versus an area where we're trying to treat a large muscle in a big area, we may change the concentration a little bit. So in any case, we're going to use 20 units, which is what we have here. I like to do a little pinch of the skin like this. It's surprising how much more comfortable that is to the patient. It is the smallest needle we can find, by the way, but you just put a little bit right in there, and I watch as I put it in, so this is it.
Did you just do it?
Yes, I did.
Oh, I didn't feel it actually.
See, I've never treated her before, so she didn't know what to expect.
No.
But the fact is that a part of the fine art of Botox is knowing what level to put it. Because some muscles are very shallow right under the skin, and we treat those differently then the deeper muscles around through here. Now this is the tail end of the thing. Once again, a little pinch. Okay, so we treated the bottom and the top. Now we're going to come around here and do a little pinch right here. This is a slightly different muscle. Technically speaking, this would be off-label, but it's part of the same complex, so we're going to treat it like that. And you'll begin to see the effect of this in about 4 to 5 days. It really takes 10 to 14 days to see the full effect. Okay. And so many times I will tell the patients, especially if they're new patients to me, I'll tell them they should come back in about 2 weeks and let me take a look. Because sometimes we may want to tweak it a little bit, add a little bit, or change things around a little bit. And certainly I like to keep a record in our computer program, for instance, on your face, for instance. We show exactly on there how much we put and where we put it.
Awesome.
So anyway, that's that. I mentioned the procerus muscle causing these lines here. We're going to put a little bit right in here right now. Okay, 1, 2, 3. All right. And once again, with that little pinch technique, you can take away the feel of the needle.
Okay, I do have to say for the record, I'm really not feeling this, knock on wood. So far, so good. But everybody's different. Yeah, you're really good at this.
Well, I actually teach.
Like, I'm seriously not, like,
you know,
it's not painful. And a lot of people actually ask that, you know, oh, is it really painful to do? And it's actually not for me anyway. So
it's a small needle. Some patients actually are just needle phobic. And I think it's important to get someone who uses a good technique, someone who really cares. I think that's the bottom line. If we get someone who
it's just stabbing people with needles.
That's right. If you're just an injector, that's one thing. But if you're actually an excellent caring physician or whatever, you'll treat the patient a little bit differently. So here goes probably the third injection on this side, a little bit. Okay, I haven't used quite 20 units now, but I think we pretty much covered the waterfront. Now, I also avoid going over here too far, and that's where they got the 3% incidence of a droopy eyelid, by going too far laterally and going too deep.
Gotcha.
So we try to put it where we need it, but that's about what I see. I'm going to do, because your crease on this side is a little heavier, I'm going to put just a slight amount more on this side. But once again, that's the art of Botox. If the creases were embedded, they were etched in the skin, they'll get better after the Botox takes effect, but they won't totally go away. I've found that some patients actually will tend to heal those a little bit. The body does heal some of the etched in creases a bit, but the fact is that probably most of those patients will eventually need either fillers or laser. Now, the second muscle group that we're going to do is off-label, because that's the frontalis muscle, but that's the one that causes the transverse creases across here. It's also the one that raises the eyebrows. But what we're going to do is try to use the Botox in order to give her a lift. But anyway, the corrugator muscle, which is the forehead wrinkles and so forth, we treat across here. So we'll probably be putting some here, and here, and here, and here, and here. What I found too in doing brow lifts, this bare space in here varies from person to person. Some people have almost none, and other people have a very wide bare space. So I usually don't treat too much in the middle. We're going to wipe it off and we'll go across here. Now, the other thing too, like I said, because gravity pulls it down, I'm not going to go all the way up in the hairline up in here, even though her creases go sort of high. We're trying to take care of those creases by dropping it down just a little bit. And I'm going to put those marks up here. And we're going to put here, and here, and here. I'm going to leave a little bit over in here. So I usually have an imaginary line coming down like this from the peak of the eyebrow, which will indicate the tail. And I'll put some here, and here, and about here. Okay, I know gravity will tend to pull that down a little bit, so that's enough. I think probably going to save just a little bit for in here too, because we don't know how wide that space is, and I may want to help decrease that, okay? I'm going to start right here in the center, so I'm going to give it a little pinch right here, 1, 2, 3, and give it just a tiny little bit, and then we're going to go around. Okay, so that's the thing, and we'll take some of those lines off. Now we've treated the frontalis muscle, and my guess is that that'll soften that up. Like I said, there may be some minor little wrinkles over here, but that's what's going to raise her eyebrow. The orbicularis muscle is the muscle that goes around the eye like this. Like I said, it's probably 1,000 muscles rather than just one, but we have one name for it. The muscle up here, which is transverse, causes lines up and down. As the muscle reorients and starts pulling down or changing into an oblique treatment, it starts pulling down. So this is what causes it to go down like that, okay? So we're going to basically treat this muscle here to stop that pull down, that depression, if you will, from here. So we'll put a little bit right in here, very shallow, and then we'll come around here and we'll treat her crow's feet. So this will be something like that on each side. So here to raise the eyebrow, a little bit here to counteract the Botox. Occasionally I put a bit down in here for people who have that muscle roll right in front of their tarsal plate. You don't have that, so I'm not going to put it in here. Don't see any wrinkles up there, but this is the one that lowers the eyebrow, so I'm going to put it really, really shallow. I give it a little squeeze, and there's a little bit there, here. There are very shallow vessels here, by the way, in this area, and sometimes you'll get a little bruise. So usually have the patient put some pressure on the muscle immediately afterwards in order to avoid the bruising. So if you'll reach up and just hold some pressure right there.
Okay.
Bruising comes about by the needle puncturing a vessel. The vessel leaks. So the way you prevent that is to prevent the vessel leaking. You put pressure on it, and actually there's a clot that forms inside the vessel where the needle went through the vessel. And that basically, within a few minutes, that'll go away. So the fact is that the clot basically is what then stops the bruising.
So Deidre, we are looking forward to seeing your after photos. I think we're going to catch those in just a couple weeks.
Yes, I can't wait. And Dr. G, thank you so much.
Well, you're an excellent patient. Thank you very much
thank you.
for volunteering, and we appreciate your calmness and demeanor, okay?
Oh, thank you.
Thanks for joining us today, and definitely thank you, Dr. G, for being with us. We'll be seeing a lot more of him, and I hope you'll subscribe to my channel, you'll like my videos, follow me on all my social media, and check out my website, www.JanetsHUB.com.
Beauty should be fun.